If you are someone who is dealing with any ankle pain, especially medial ankle pain, with squatting, with going up on your toes, with any type of Olympic lifting or things that involve triple extension, you will not want to miss this case study. Hello, everybody. Zach Couples, physical therapist here, and we are going over today session number 3 with my main man, Kay Tran. For those of you who don't know, Kevin, he is a former intern of mine, and he is an Olympic weightlifter who has been dealing with, initially came to me for some shoulder issues, but now he's been dealing with some left medial ankle pain that has impeded his Olympic lifting. If you want to see the first 2 sessions, you can see session 1 right here, and then session 2 is right here as well. So if you want to get caught up to speed, I would check those out first, but you don't have to watch them in order to get something out of this. And so I just want to update you on the progress that Kevin has made since he last saw me. Now, I had seen him on April 10th, and the second time that I had seen him, or this follow-up, was on May 14th. So a little over a month's time, and here's some cool stuff. So he had stated that his pain levels are overall down from 5 out of 10 when I saw him in April to now 2 out of 10 for 10 days, which is pretty dang significant. He's also been back to training the Olympic lifts for 3 weeks with no increase in symptoms, which is huge. Now, he did have a flare-up in symptoms by playing some pickleball because he hasn't played anything at that intensity in a long time. So there is that, but overall, substantial progress. He's also noted that his knees have been popping a lot. And lastly, but importantly, his shoulder, his left shoulder, which he initially came to see me for way back when, is feeling pretty good. Only notices slight discomfort when he's doing some overhead stuff and still feeling a bit asymmetrical, but overall has noticed some significant improvements. Now, I bet you're thinking, oh, wow, I wonder how he's going to present today. Well, that's what we're going to look at next. Go ahead and check out our initial measurements. So go ahead. How's that feeling?
Much better.
No pain, discomfort?
No.
Can you do your heel raise? How's that?
Better.
Are you still feeling some?
Like a tiny bit on the left side, more so on the inside right here.
Okay, so if you're getting something, I won't go single leg just yet.
Okay.
And that's about 160. Sorry, I don't have the second camera angle today, peeps. 40. Maybe like 75, 80, somewhere around there. If your ER is better by chance, which it is, I'm going to say that's less because of an orientation thing. So 60, 45, so that is better, because before you only had about 45 degrees of ER. Because my guess was, 80. My guess was you're probably bending through the spine to get that. Yep, you're good, you're good. Nice, 110. 90. 90. That's a lot better. You had 85 shoulder flexion last time. Boss. About 110 as well there, which I think you were also at about 85. Yeah, 110. Nice. Oh, actually 80 on the right. Nice. Cervical rotation. Yeah, it's still a little sus, as the kids say. You say that? No?
No.
You're not bringing that back? No.
No.
Your side facing that way, and then we'll do knee and ankle after this. I'll just have to zoom in. All right. Scoot back towards me, please. Perf. I think kids say that too.
They definitely do.
I say it a lot. I can extend you. Adduction's about 25. Head on the other side. 4. Okay, so that's about the same, but you got abduction. I can extend you. Couldn't extend you last time. Let me just see how knee hyperextension is. Is that okay?
Yep.
You got a little bit of bounce, actually.
Yeah.
It's still less on the left, but I can move you. Ankles. Ankles, 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 ankles. Okay. So with this, we got some dorsiflexion, 10. Plantar flexion's still fairly limited. Still got a lot of eversion. Big toe extension still like not much. Yeah. 15, 35. Yeah. Maybe a little bit more big toe, but not crazy. Whereas here, that's interesting. So you got a lot more dorsiflexion on that side. This side's a little bit less comparatively, and you got plantar flexion. So we're gonna have to do some stuff to flip-flop that, I think. And that big toe still about the same restriction-wise. So let's compare the measures from the last time I saw Kevin to today. We're going to look at this in comparison to the initial findings that we presented with in April. There are the initial measurements. Let's compare how these look to when I had seen Kevin a month previously. Overall, major progress. So importantly, when we look at the toe touch to squat, you can see that it was painful in April. Now, boom, not so much, which is great. He is having pain with the bilateral heel raise. He had that at the previous appointment. If we compare hip flexion and straight leg raise, you'll notice that hip flexion is actually a little bit less this time, but straight leg raise is more. I'm going to tell you what I think that means when we look at the hip rotation. Now let's move on to the hip rotation. You'll notice back in April right here that Kevin had 45 degrees of ER. Now he's up to 60s on both sides as opposed to just having the 45. So when I see normal ER, an improvement in straight leg raise, but hip flexion is less, chances are that when I tested Kevin back in April, he was likely getting the hip flexion through his lumbar spine. And the reason why I say that is because at 90 degrees of hip flexion, he didn't have full external rotation capabilities. So then, wait, how did he get beyond that? Likely by posteriorly orienting through the lumbar spine. Whereas when I look at this now, he's got full external rotation. And you see the hip flexion's less. That's probably actually his true hip flexion. And he's not no longer compensating through the lumbar spine. When we look at the remaining measures, look, we didn't do anything shoulder-wise, but we did. Look at this big improvement that Kevin got in shoulder flexion. He's now at 110 bilaterally before he deviates into IR. That's like a 30-ish degree improvement, which is significant. Other things I saw are pretty dope. He's got good hip extension. We're now getting into adduction. Didn't have that last time. We got cervical rotation was still limited, but knee extension improved. So overall, he's made some significant progress with a lot of the axial skeleton measures. And when you look at this, it's like, well, wow, this actually looks pretty good. Kevin's not super asymmetrical. But why is it that he's still having some discomfort in his ankle? Well, that's where we have to look at his ankle measures, and there we can see some of the asymmetries manifest. And the big one right here, folks, so on the left, this is the April measures. On the right, these are the May measures. You'll notice that right here, although the numbers have improved overall, except for dorsiflexion, his dorsiflexion is actually a little bit less this time. But look at the asymmetry between dorsiflexion. This is on the right side, so the left-hand column is right, the right-hand column is left. But the big thing I'm noticing, folks, is he's got a loss of dorsiflexion on the right and a loss of plantar flexion comparatively on the left. And so what does that tell us? Well, we know that plantar flexion promotes external rotation through an extremity, and dorsiflexion promotes internal rotation throughout an extremity. So if I have a loss of plantar flexion on the left, we know that that's a loss of external rotation. Conversely, if I have a loss of dorsiflexion on the right, we know that's a loss of internal rotation. And so that means that Kevin has a bias of internal rotation on the left-hand side and external rotation, more so, on the right-hand side. And so what that does is it creates an asymmetrical turn. Rule of thumb, if I'm internally rotating, that's going to promote contralateral rotation. And if I'm externally rotating, that's going to promote ipsilateral rotation. So what that means, folks, is if I have a loss of external rotation on the left side, that's going to turn the pelvis towards the right, especially if I have ER capabilities on the right-hand side. So what we're seeing here is a distal foot manifestation of an asymmetrical pelvic strategy. And that strategy, folks, is a right oblique oriented pelvis, which we saw in previous iterations when we were working with Kevin. To catch you up to speed on that, basically what happens in this case is if I'm a wide ISA, so that's going to have a more nutated sacral position, so the backside is going to be more eccentric. If I tip the pelvis up like this and I make the left posterior more concentric and orient into the right direction, or the direction towards the right, that means I'm going to be pushing off on that left-hand side. That's going to pull me back into the right hip. And this is a orientation issue that we're seeing with Kevin. And that orientation issue is going to cause this asymmetrical presentation that we're seeing with him. So we still have to progress Kevin's ability to turn to the left. A lot of the interventions that we had done in the previous scenario, or the previous session, I should say, are going to be helpful, but we need to make them more challenging. We need to bias more of a foot strategy in order to make this happen. And so what I have to do in the case of an oblique axis representation is I need to close the right posterior and allow that to open up the left posterior, so that way I can turn back to the left-hand side. And so what we're going to do is we're going to try to devise strategies that will manifest that. The first thing that I ended up trying with my main man, Katran, is progressing a move that I had already given him. So I had given him a lateral squat iso hold with the left foot elevated. So he was pushing right to left. That's going to help close the right posterior and open up the left posterior, theoretically. So all I did was try to make it a little bit more dynamic. I gave him a lateral lunge this time to a box, and I had him hold the weight in his right hand, so that way that could promote the turn to the left. When he holds the weight in the right hand, because the weight's pulling him right, he's got to counteract that and go left. And then when he was coming out back to the start position, I had him switch hands into the left side, so that way it eased his ability to push out of the left hip. Let's see what happened when we gave that a shot. All right, so before you were kind of, I gave it to you with a box last time, yeah?
Yeah.
Okay, so before it was this, right, with the weight, which is fine. Now I just want to progress how aggressive we're getting the turn in on that side, so that way we get the IR, get the knee extension, what have you. And so what you're going to do is be off the box, soft knees, hips square like you Huey Lewis, right arm. It's going to be, I'm going to push through that arch on the right, right? I'm going to step, inhale, switch to the right, or left, excuse me, exhale, okay? So it's inhale, use that to drive into that side, exhale, use that to drive out. Does that make sense?
Yep.
So it's a lot of the same cues. See it?
Yep.
Give it a shot. slower. You gotta get this. You gotta get that scoop. You had no scoop. So get the foot contact. You feel that? Okay. Go ahead. I'm just gonna show the fam. So if we look at Kev, you see how the hips are kind of staying flat like that? So I don't want that. I want, and then the other thing that I'm noticing is the torso is going to the right. So what you got to do is, so step there, I'll show you where I want you. Here, this has to scoop up. So scoop your hips up. Chest has to be over the leg like that. So it's left chest over there. Keep it in close like that, all right? So inhale, switched hands. So you want to, it's here, switch hands, then come up.
Oh, no. Still not there. Okay.
Yeah.
Got it.
Switch, come up. Yep. There you go. So all I did was just move the hips on that square position. One more. Take a rest. How was that?
Good.
A couple things. So when you're doing it, so stay a little bit more upright as you go. So I want the right hip drops, the left hip comes up like that, okay? What you're doing is you're going like this. That's how you're getting down. So it doesn't have to be very, yeah. So you want to think about scooping. And maybe what we'll do, instead of actually doing this, is just get set up like you were and see if you can get that oscillation like that, okay? And then the other thing is it's inhale, switch, exhale, come up.
Inhale at the bottom.
You're going like, yeah, that's not doing anything. Because essentially what I'm trying to do with this is I want to get you here, so we drive into that hip, and then exhale, you're going to switch hands, because then it's going to assist turning you out. Does that make sense? Because when I have the weight here, it's pulling me this way.
Okay.
So if I don't want to pull that way, I have to go the opposing direction.
Okay.
All right? So 2 keys. Swivel the hips. There, without this happening. That's how you're going to try to get it. So maybe only go that far. Exhale. Switch. Okay? Go slow. Slow motion like you're juvenile.
More slow. Start on here?
Yep.
Okay.
Yep. Switch hands. That's okay. I got you. So inhale, switch hands, exhale. Better. Awesome. Good. So that's a little bit better lean. That's good. Nope, I'm just talking to the fam. Notice the chest position. Again, still could get a little bit more swivel, but not bad. Go ahead. Set it between your ankle. Aim for your ankle. There it is. Rest. How was that? What'd you feel?
Left booty?
Left booty? Were you getting any right?
No.
Okay, I want to see if we can get some right then. So, really make sure you feel inside heel in the arch on the right, or in the first met head. So I'm going to get that. Got it. I'm going to use that to push me this way. Okay? So it's that right there. Like as soon as I do that, like I'm putting weight into the ground, I feel this kick in. So go slow, like make it that pace. All right, try it again. Hang on. Point this forward. Yeah, there you go. Okay, do you feel your weight here?
Yep.
Okay. Do you feel your weight there?
Yep.
Use that to push you left. How was that?
Better?
Did you get it?
Yep.
Use that, go slow. Use that to push you left. Right there, switch hands. Exhale, come up. There you go. Nice. We'll go for 8 of them. Here's how we're looking. So cue in that push, just like that. Awesome. Good, nice job, Kev. One more. Keep that foot flat, both feet flat. Yes, nice. Is that okay? Awesome. Try your heel raise now, just see how that feels.
Still a tiny bit.
Still a tiny bit, about the same as when we first tested?
Maybe a little bit less.
Don't make me feel good, I want you to feel good. Okay. Okay, let me check you here. So the hip flexion's better. Yeah. And the leg raise is also better. So I had you about 110. That's way better. So that's about 125, 130. So I'm happy about that. So if we're getting the flexion measures to improve, then I'm fairly stoked. That's still a little limited. Not as much on that side. Oh, that's better. There with that. It definitely feels a little easier. Yeah, I mean, we got dorsiflexion now. Yeah, that plantar flexion is still limited on that. That's pretty good. Yeah, I mean, your knee extension is pretty solid. Got some decent improvements, but I wasn't super enthused. We got, a 10-degree improvement in hip flexion on the left. Shoulder flexion continued to be boss status. We gained about 25 degrees on that, which was nice. And we gained about 10 degrees of ankle dorsiflexion on the right, but didn't really get the plantar flexion change that we were hoping for. And some of the big issues that I would have wanted to tweak, we had a little bit more time to focus on that, is you notice that when Kevin was doing it, he was kind of orienting everything that way as opposed to keeping everything square and then just creating that oblique presentation in the pelvis. So it was an okay move. I thought we could have probably done better with this one. I think had I had done it again, I would have just had him do a dynamic lateral squat without the switching. That would have probably been the initial thing that I would have switched about that. Also, I would have liked to have recaptured a bit more plantar flexion. I think we could have possibly, just to allow him to externally rotate a bit better, maybe also done a heel elevation on the left side, but that's the way it goes. And so with that particular move, from a pelvic standpoint, if our goal is we want to create that position right there where I'm turning maximally to the left, this one is more centrally focused and pushing that way so we can elicit the turn. So it's less degree of a turn. And so what I wanted to do this time then was I kind of figured, well, we're getting some really nice improvements with some of the axial measures. And I'm wondering if maybe we could just change the orientation of the pelvis and get him to push back into the left that way to see if it recaptures some of the external rotation and plantar flexion that we need. And so what I opted for on this one was a right split squat. We initially tried a rear foot elevation because what that's going to do is now I'm going to use my right leg to push me back to the left. So when I'm oriented in this position, now I have to create that increased muscle activity in the right posterior, which theoretically, if I can squeeze the right posterior, that's going to help promote the turn more so to the left and hopefully allowing me to gain plantar flexion back. And so that's why you would choose a split squat. Why do a rear foot as opposed to a front foot elevation here? Well, two reasons why I went with a rear foot elevated split squat. The first is I didn't want it to turn him maximally back to the left, so I didn't want to put as much load on the back leg. If I elevate the rear foot, that's going to shift the weight more towards the front leg. So he's going to be in a left-oriented position, but most of the load's going to be on the right. So it's less degree of a turn. Conversely, if I went with a front foot elevation here, that's going to put more weight on the back leg. So then he's turning even further to the left. So I wanted to grade the degree of turn that we did with Kevin. The other reason I went with a rear foot elevated split squat is because Kevin does not have an adequate amount of big toe extension. And so I didn't want like any external rotation of the lower extremity at all as he was in the back position. So my thought was that by ensuring that we're not pushing the big toe extension, that we'd able to keep the hip positioning that we desired. Did we do that though? Well, you're about to see a lot of trial and error with this move. Check it out. I want right foot forward. You're going to put your left foot in the rear foot position. Weight on the right side. I want soft knees, looking up. You're going to inhale down, exhale up like that, making sure the knee stays centered. Don't need a crazy tuck or anything, just inhale down, exhale up. All right, should be front quad and glute. See what you got. If you're feeling back hip flexor or like a big stretch in the back, please tell me.
Good there?
I think. Bring this, yeah, right there. Yep. Oh, do you need something to support or you feel okay?
Good?
Yeah. Okay. So you can see your back knee's going in, and the front, actually both knees are going to the left, Kev. So you need to keep your knees centered a little bit, so twist out slightly. That's better. So see if you can keep that foot position. So foot flat, knee centered, because you're caving in. But the thing that I don't like is that left leg, which I'm going to see if I can fix that. Go ahead. Good. And take a rest. How was that?
Yeah, I could see that. I was kind of wiggling a little bit.
Yeah, and so what's happening is this is trying to turn you left.
Yeah.
You can't get there, so you're orienting everything, and that's why. And so I was actually trying to minimize that by putting more weight on the front leg, but I need to see if I can devise a way to where you're not turning as far left. So I'm going to do two things for that.
Yeah.
I'm going to have you switch to the left hand.
Okay.
Okay? So that'll be one. That'll turn you a little bit more to the right. And then you don't do well with heel elevation.
I don't?
No.
Okay.
Because last time you couldn't keep your first ray down, or your big toe extension. Let me just.
Heel or like foot elevation?
You were doing this. I was thinking heel. Well, no, foot elevation is not going to. It will minimize some of the load.
Yeah.
But you got to look at it like this. Like,
I don't know if we used heel elevation last time.
I tried on the tilt.
Oh, okay.
And then I didn't like it because your feet were splaying out into a lot of inversion.
Okay.
Does that make sense?
Yeah.
Yeah. So I don't know if that would be helpful. So I'm going to just see if I can minimize it by having you put it in the left hand so you're turned a little bit more right. So it's kind of like left facing, turning right. Okay. All right? Shorten your stance a bit too. That might help us. Yeah. Oop, hang on. That doesn't look comfortable. Sorry. There you go. So you got to keep the foot flat. Unlock your knee a little bit. Yep. Twist it out slightly. Inhale straight down, slow. Exhale out. So the depth is lower, but still getting the knee to cave in a bit. But I like, it's a little bit less archy. Don't go all the way up. Don't go all the way up. There you go. Just burn it out that way. Nice. It's good. How was that? Good burn on that side?
A little burn.
Okay.
Felt more stable, yeah.
Did it?
Yeah.
Just try your heel raise now out of curiosity's sake. Just see how it feels. Yeah, they don't need to see it. We're going more by feel.
Maybe about the same.
Okay.
Same as before. No worse.
So I'm going to do this just to see, because you're like at the top.
Mm-hmm.
You're going like this.
Okay. Overarching. Yeah. Okay.
So I'm going to see if that does the trick.
Maybe, like fall back more.
No.
No. Okay.
No, you were good. I just think it was too high. Is it?
I think it moves.
Oh, is it a little wobbly?
Yeah.
Okay.
It's like hard for me to like not drop my toe down.
Yeah. Yep. I got what you're saying. Well, you know what? Not ideal. Let me have you just try it with this, just to see what we get. But like at home, could you rig up your rear foot to be that low?
Yeah.
Okay. Do it that way.
I have like square tiles.
Oh, it's right on. Right on. I just didn't want the big issue is I don't want. Yeah, because you just don't have it.
So like that.
Yeah.
My stance good.
So far, so good from what I'm seeing. Very subtle tuck. No, that was good. That's fine. So that's probably the best that we've got in the back leg. Still coming out a little bit, but I like the front knee. There you go. Okay. How was that?
Not as much burn, but
Were you still getting burned on the front leg?
yeah, more, just the front.
Cool. Okay. So I still want to make some tweaks. That was better because there's two things I want to get with you. The first is we just got to make sure that you're not arching at the top. And then the second thing is not letting the legs to come out that way. So here's what I'm going to try. Let me see how you do with this. So heel elevation here. And then the other thing is I want you to just get a little bit of the hips back like this.
Okay.
Okay? Because my thought is I'm going to limit the hip extension on the back leg by hinging you slightly, just to see if that makes a difference. Okay? Good. So, yeah, get the hips back slightly. So you just bent at the waist. Yep. So do this. Reach forward, hips backwards, like that. Okay? So I'm liking that. Go stupidly slow. Straight down, straight up. Let your arm dangle a bit. See how he kind of came up that way? Keep going. So that's probably the best the back legs looked. And I'm liking the knee-centered position on this. Rest. How was that?
Yeah, I'm feeling it.
It's going to be more back of the leg than quad with that, possibly. But
More back of leg, yeah, but
okay.
Still more
Sure.
quad.
Okay.
Yeah.
I know I'm crushing you a bit, but hey, the fam dig it. I want one more set.
Yep.
I just want to show you something that you're doing. Watch me from the side. So, two things on your setup. Legs, like the back legs and all that were good. You got to get here, okay? So I'm here like this. And then you want to think straight down. This is staying dangling and up like this. So you see how my torso is not moving? You did this. You kind of rode to come up.
Okay.
So that's you pushing forward.
Yeah.
Whereas I need you to be able to use the glutes to get the push from a more stretched position. So it's here, that, not that. Okay? Go for it. Use your right hip to drive it. Unlock, yep, so you're going to grab the weight, unlock the knees. That's solid. So straight down. You're moving your trunk. Let the arm dangle. Hips down, hips up. Hips down, hips up. So it's up, down, up like that. Yeah, yeah. Did you feel that?
No.
Oh, got it.
Slid a little bit.
Down, up. Let that knee come a little bit forward, Kev. There you go. So you can see that the leg position is quite a bit better with this. Getting a little bit of forward knee, not a whole lot. There we go, that's better. One more. Nice. So yeah, those last three, forward knee position was quite a bit better. Let's see what happened with that. Got it. That's a little bit better. Those dorsiflexion on this side is wicked good now. Awesome. We got some. Now I can actually pull them down a little bit more without automatically going into inversion. Big toe still stiff as can be, but I'm liking that. Check your heel raise now after that, Kev. We'll go like right over there. Go ahead. It's good?
Yep.
Awesome. Can you do a single? No way balance. Are you getting something there?
Maybe more Achilles.
More Achilles? Not so much medial ankle, but like discomfort Achilles?
No, just like maybe like a stretch.
Okay, got it.
More like lateral ankle now.
So you can see after many trials and tribulations, we were able to get a pretty nice change. We finally got the ankle to budge in plantar flexion. We gained about 5 degrees on the left. We gained a boatload of dorsiflexion on the right. That means that, my main man K-Tran is starting to turn. We need to get a little bit more plantar flexion on the left still, but I'm encouraged by the improvements. The other nice change with that move is we were able to increase right hip flexion finally to about 110 degrees. And so I was pretty stoked about this improvement. What I wanted to do now is I still wanted to keep a left-oriented position, but I wanted to work on a few things to both drive plantar flexion on the back leg, because we still need some of that. And also, too, I found that increased concentric muscle activity on the right posterior seemed to be helpful for him. But I wanted to do this with a higher speed activity, because we need to try to bridge the gap from the high-level exercises that Kevin is doing, which is Olympic lifting. And so what I opted to do here was devise a plyometric on the spot to see if we could both drive plantar flexion of the ankle as well as create some inherent stiffness in the right posterior lower pelvis. And so here's what I came up with to do that. Now you might be thinking, Zach, that was some pretty rock solid coaching to get Kevin to where you needed to be. Where do I learn to coach like that? Well, you got to master the basics first. And it just so happens, folks, I have a seminar where we can not only give you an assessment so you can choose exercises like this, but you'll be able to take your coaching to a very high level so you get more out of the exercises that you're already using, make it more effective for your clients so they can get out of pain faster and reach the performance goals that they so desire. And the way to do that is coming to my seminar, Human Matrix. We have a couple of them coming up, August 6th and 7th in Boston, Massachusetts, if you're watching this in 2022, and October 15th and 16th in Slovenia. I got some others coming along. They might be in the description below by the time this comes out. You don't have to go very low, but I'm going to have you step off to there. That's it. So think, hold on to the heel, drop into a little bit of a squat. You don't have to go all the way down, but I'm just trying to get that last bit of plantar flexion. Okay? See what you got. Good. You just got to keep the knee centered a bit.
Right knee.
Yes. You see how it's falling a little bit forward. So just a little bit more upright, shorter stance. There you go. That was way better. 2 more. Awesome. Good. How was that? No issues? It was okay pushing off like that?
Yep.
Awesome.
It's okay because my left foot turns a little bit.
At the tail end?
Yeah.
Yeah. You don't have much plantar flexion, so that's why I would say you almost want to think about hanging onto the heel as long as you can and then go. All right? So imagine you got gum on your heel and you're like, there. All right? Try it again. Yeah, that's a perfect range. We're going to do 8 of them. And so you can see just shortening the range, it's not getting as much of that twisting out. And that's why I had them hold onto the heel a bit longer. Yeah, that's perfect. Good. That was okay? Awesome. Why don't you hang on to the rack, try your single leg heel raise now, just see what we got. How's that feeling? Not too bad? Nice. Hip flexion. Yeah, that's pretty solid. Not bad, dude. Yeah, I mean, that's pretty solid. That okay? Yeah. Yeah, I mean, I would say overall, it's still a little bit less on this side, but definitely improved compared to where we started. So, awesome. We're going to go with those 3. And there you have it. We were able to get 45 degrees of ankle plantar flexion. Everything was looking pretty solid. And most importantly, his heel raise, which now we were testing a single leg heel raise at this point, was pain-free. So overall, it was a big win. You could see some of the difficulties that Kevin was having with that, namely that he had that tendency to spin out. And so what I did was I had him hang onto the heel on the back leg for as long as he could. That way we didn't drive a significant amount of plantar flexion, but he was still plantar flexing, right? It was just less of a range. And then the landing that I devised, because he has to create an abrupt stop at the bottom, he has to increase stiffness in the posterior lower pelvis on the right, and we were able to do that. And so overall, I was pretty pleased with the outcome that we got today, especially with the last 2 moves. I think if I were to have done this session over again, I probably would have gotten rid of the first move and shifted the 2 moves to what we did in the beginning. And then my 3rd move would have likely been something that progressed more so on the previous one that we did. So maybe what I would have done is like a retro bound going right to left, because that would have helped get me back into the left a little bit more, but not really challenged the plantar flexion demands that Kevin doesn't have. I think that's probably what I would have switched to, just to drive a little bit more of the turn. Because you figure with the landing, I'm creating a stiffness in a hip position that's moving towards an eccentric. Whereas if I do a retro bound right to left, I'm now in that position. I'm generating a concentric action to go back into the left hip, and then I have to create an eccentric action to control the landing. That's probably what I would have switched to. But overall, I'm pretty stoked about the progress. Where I'm thinking I will go with Kevin next, depending on how he's looking, is we still got to get that plantar flexion. So a lot of the transition's going to be this right to left, like I talked about with the bound. His terminal move is probably going to be able to do like an offset deadlift with the left leg back, because there it's going to challenge him to maintain dorsiflexion without, folks, collapsing through the midfoot, which is Kevin's tendency. So we'll do that, then teach him to explode out of the left hip by perhaps doing like some type of forward lunge activity. And I think if he could do those things, and then we progress that from a plyometric perspective, he's probably going to be in a good spot. And that, folks, is how this session went with Kevin. What struggles have you had devising higher level activities for your supreme clientele to drive movement? If you had someone like this and you're like, man, I wonder what I could have done differently in that case, why don't you go ahead and comment below and let us know. And of course, folks, while you're here, hit the like and subscribe button because it helps me promote my stuff to the almighty YouTube algorithm so we can help the fam grow like for show. Otherwise, thank you so much for tuning in. You've been an incredible, outstanding audience, and I hope that you keep it real but not to the extent where things go wrong. Stay hungry, stay learning, stay moving, and I'll see you next time. Deuces.